AI in medicine, hype versus reality. Would you trust an AI to read your x-ray or draft your doctor's note or predict a health outcome before you even feel it, a health problem before you even feel it? That might sound like science fiction, but it's happening in clinics and hospitals around the world right now. The setting of AI in medicine is twofold. One is the inefficiencies and the doctor and nurse shortages in medicine, and the other one is simply health outcomes, the quality of medicine being practiced, and are people getting better? Do we have the right strategies for improving health outcomes? So AI is stepping in to help on the efficiency as well as the quality metrics. Think of AI kind of like GPS in your car. It doesn't, for most people, doesn't completely drive for you, but it helps you find the best path and avoid mistakes along the way. AI is very similar to that. So today AI can already spot lung nodules on CT scans or detect breast cancer on mammograms with accuracy that you could argue is close to radiologists, and in some cases probably pick up spots or findings on imaging that the radiologist may not even see. It's also listening in on doctor-patient visits and automatically creating the medical note, which can save hours of charting time. And it can predict who's at risk for sepsis and heart failure in certain medical settings before symptoms are even obvious. And it can do some more simple things like scheduling appointments and in some cases answering common patient questions. So most of the time patients don't even realize that AI is already working behind the scenes in some capacity. But the challenges here are, I think, twofold. One is that patient information is very sensitive, it's confidential. We never want patient information leaking. And for that, the main step that is being taken with AI is HIPAA compliance, and so it's having a safe, I believe, a safe network that this information is going through to keep patient information confidential. The other challenge here is, are we using AI in a way that is actually decreasing health outcomes or improving health outcomes for patients? I will say anecdotally, in my experience, I use an AI called Open Evidence. I use it in some medical settings. So with Open Evidence, what's happening is I may input some patient information, especially, let's say, a complex medical case. And what it's going to do, it's going to sift through everything from lab results or findings on imaging and all kinds of pertinent clinical history of a patient. And it's going to tell me the most important things to consider. And one thing I really like about it is that it will also tell me which key higher risk diagnoses or what are the higher risk concerns potentially involved in a patient's case. So basically things to not miss. And I find that very helpful because I give it some information and it's going to be pushing that information through current guidelines. It's going to be pushing it through medical evidence-based studies, basically, and it's going to kind of give a roadmap and make sure that we're considering all facets of the clinical information, which I find hugely helpful, especially with complex medical cases. So for me, AI, I believe, is improving the quality of patient outcomes because it's able to take so much into consideration, and it's able to remind me of things to be careful of and to investigate further. Of course, with any tool, the tool can be used the wrong way. A screwdriver can be used like a hammer, and then you end up marring up the walls and that sort of thing. So over-reliance on AI, replacing my clinical experience and clinical medical decision-making with a computer is not the way to go, right? To completely swap one out for the other is not the way to go. But to use it as a tool for greater context and to guide decisions, I think it's extremely helpful. And I think that it can definitely improve patient outcomes. It has to be utilized the right way, though. So looking ahead, the next step is a multimodal AI where we could, let's say, combine scans and lab results and multiple medical records all at once. And then AI could take a deeper dive into all the considerations than a clinician may readily make, by looking at those things. Also, from an efficiency standpoint, just the continued use of AI for documentation and certain mundane processes. I think could free up doctors to do what they do best. And so I think that there's great promise to AI. I think it's already helping in a big way, but with every tool, we have to look at what are the weaknesses like privacy or over-reliance. We've got to guard against those. And then I think other than that, we need to embrace the areas in which it helps, as long as we aren't experiencing big downsides from that. So is AI replacing doctors? No, it's not replacing doctors. I think it is closing the gap where doctors are getting caught up with mundane tasks, and it's also helping doctors think outside the box. And I think that patients would probably think that it's a positive thing for a doctor to think outside the box, and it certainly does help with that. And so AI, I think, is coming in a big way. It's already being used now, I think, in a very helpful way. With that, guys, our featured service at Command is prolotherapy and PRP. Prolotherapy, prolotherapy and PRP are injections. They're orthopedic injections in any one of the joints, main joints in the body. Prolotherapy is dextrose. When it's injected into a joint like a rotator cuff tendon, or a knee with arthritis, or an elbow with tennis elbow, what it's doing is it's basically waking up the healing response of the body. And then the body will, with that inflammation, it will send more blood supply there, and it will send platelets there, and those platelets will take growth factors and that are on the platelets, and it'll start repairing whatever's going on there. And it can buy people time for, knee replacements, for instance, with arthritis, and it can also help with a lot of tendon or muscle issues too. PRP is platelet-rich plasma, where we draw people's blood, we spin it down, and we take the platelets out. When we inject those platelets into orthopedic areas, it is going to wake up the healing response, but it's also going to deliver a bolus of those healing properties, those growth factors that are on the platelets, to the injured area. And then we tend to see a significant healing response there. And so we've had patients that have literally been signed up for surgery, and they've done one round of PRP, and then they canceled the surgery because they were doing so well. So the cost for PRP is $300. It's $600 for non-Command members. And prolotherapy, which is not as effective as PRP, is just $50 for patients. And so if you think that you might benefit from one of these, please talk to your Command provider. If you're not a patient at Command, feel free to reach out to our Command clinic phone number, and we can see if prolotherapy or PRP is a good fit for you. Guys, thanks for watching, and we'll see you in the next video.